Hey guys, ECRG here, back with another episode. Today we're going to be talking about when you see those job board applications for those clinical research positions and they say, we want 2 to 3 years of experience. Or you see something like a clinical trial assistant position and they're saying 2 to 3 years of prior clinical research experience. So what do you do with that situation and how do you handle that? But before I go into that, I want to let you guys know about the resume review program. If you want your resume reviewed, if you're looking to break into the clinical research field, this is something for you. This is going to shortcut all of that noise, all of that getting your resume rejected. This is going to shortcut or really raise your expectations of what you can expect when getting into the clinical research field. It's not going to eliminate it completely, but it's going to help improve your chances at landing a position in the clinical research field tremendously. So let's get back to what happens when you see a job posting that says 2 to 3 years of experience. And so what you got to understand about these job postings are that those are the ideal candidates. The ideal candidate would have 2 to 3 years of prior clinical research experience, plus all the other stuff that they're listing underneath. But most of the times they do not get that perfect, picture perfect ideal candidate. And a lot of things happen. Sometimes they went over budget on another candidate, and the budget's actually a little bit less, so they might take a chance on you with only 1 year experience, or with no experience for that matter. There are different reasons, so that's why you should not just discount these positions, especially if these are the entry-level roles: project specialist, study coordinator, clinical trial assistant, project coordinator, those type of entry-level roles in clinical research. Of course, they do hire senior level in those roles also. But but that does not mean that you should not apply to them. So one of my strategies that I teach people that come into the resume review program is that you should apply to these positions even if you feel like you're underqualified. Why? Of course, the chance that you're going to be rejected is a little bit higher for when they're asking for that. But the chance that you're getting rejected is always high. So that shouldn't deter you. But you get a lot of things. One, you may get a call back from a recruiter. And that's an opportunity to tell them about yourself, tell them about your prior work history, tell them why you'd be a good fit for the job. And a lot of times, I'd say probably 50% of the time, they're like, okay, well, you don't have enough experience for this role, but I've got another role coming up, or I've got another role that I have right now that you'd be a great fit for. Are you interested in that? Well, there you go. You just got another role that probably wasn't listed, and you have a shoe-in for an interview at least. Because the recruiter is going to recommend you for that role. So that's why I always recommend applying for a lot of positions, first of all, and even applying for ones that you're underqualified for. Two, I recently had a client of mine who got a role that was much higher than what she even applied for. So strange things happen in these clinical research field where you might end up with a role because they really need someone in there, and it's really not that hard for a lot of these positions that you can get in there and learn, especially if you're hungry, eager, willing to learn, that you can actually end up getting these roles. So it's not that far out the possibility, but it's really a win-win-win. Because worst case scenario, you just get rejected, like you've been getting rejected this whole time. So what's the big difference? Now, I do not recommend applying for, say, like a senior CRA. That's just completely not going to happen. Or a senior project manager or project director. So you've got to kind of understand what they're asking for. So when you see a entry-level CRA is not an entry-level position, first and foremost. And if you read the job description, they're saying they want 2 to 3 years of either prior CRA experience or prior clinical research experience. So CRA is not an entry-level role. And you see this a lot. A lot of people email in to our email, eliteclinicalgroup@gmail.com, saying, look, I have no prior clinical research experience. That's not what they're saying. I'm paraphrasing. But when I see their background, they have no prior clinical research experience, and I want to be a CRA. Help me get a CRA position. Not going to happen. CRA is not an entry-level role. So let's go ahead and stamp that in the bud now. But there are entry-level CRA programs where you've got to be trained, intensely trained for 6 months, sometimes up to a year before you're allowed to be a CRA. So they do have those. But for you to just apply for a CRA role without any experience is just not going to happen. Sponsors don't want that. CRA is too important of a role, so it's not an entry-level role. And, I've been seeing more and more people email in about that. So let's just put that to bed now. But a position like a study coordinator, there's levels to it, but that is an entry-level role. Of course, you can have your more senior study coordinators also, and they're worth their weight in gold. Trust me. The guru always talks about that. And from a CRA perspective, a good study coordinator makes everything run smooth. The PI doesn't really do much on a study. They just review the patient chart and stuff like that, and sign off on safety reports and things of that nature. The study coordinator is the heart of the whole operation. They make everything run. But it is an entry-level role. You can get into study coordinating as an entry-level person. So if you see one of those, they say they want 2 to 3 years of experience, you can apply to that, because they may have someone that's going to be able to teach you. They may be able to bring you up to speed very quickly. And it's a tough role, but you can do it. It is entry-level. So I would apply to those type of roles. If you see those entry-level type roles, like I mentioned earlier, project specialist, study coordinator, and they want 2 to 3 years of experience, apply. Because you might end up getting it, or you might end up getting an interview. And then you have the ability to meet these people, have them recommend you for other roles, hone your interview skills, and hone your resume. They may even give you tips on their resume for applying to that organization. So it's really a win-win-win all around. And that's definitely something you should consider. I typically recommend shooting for 200 jobs when you're trying to break into the clinical research field. And obviously there's not 200 zero experience jobs. So you've got to kind of say, okay, if they want 1 to 2 years experience, I'm gonna apply to that too. If they want 0 experience, I'm applying to that too. If they want 2 years experience, I'm gonna apply to that too. So you just gotta really keep shooting, and it's a volume game, and you want to keep applying. So that's pretty much the message of this episode, guys. If you have any questions or anything, want any interview prep or resume review prep, or resume review help for that matter, email me eliteclinicalgroup@gmail.com. Take care.